organized violence and torture was at its peak, and the few of us that came together were not happy with just treating patients and sending them away. And once again, I would say that I think our conscience, told us that we needed to do more than just treating patients. We felt that we had to be advocate for our patients. We also felt that the health professional that was attending to these patients needed the support of an organized group of doctors, so that at least they can feel safe, that they can do their work without fear.
You would take your child with a hot body and fast breathing to the clinic, and they would get paracetamol, and you would go with a urinary infection and you'd get paracetamol. So over time that degrades people's confidence.
The majority of Zimbabweans, who are probably above 80%, because the unemployment level in Zimbabwe topped 80% plus, and I don't think we have gone below that. So those ones have got no access to a steady income, and they rely almost entirely on the public sector.
TB, we need to kind of keep the epidemic under control, and we're not able to do that right now.
No matter what we do, no matter how many, how much investment we put in equipment, hospitals, and drugs and so forth, it doesn't make any sense to have all those things in place without the necessary, health workforce to deliver the services that we desire.
The HIV epidemic and the TB epidemic are going concurrently, especially in the sub-Saharan Africa. And Zimbabwe is not really an exception to that. One of the major problems that we have in the TB program in Zimbabwe is the lack of laboratory support.
There are some injuries that have presented to hospital as a result of torture. But the torture cases usually come around about the period when there are, like elections, for example, or when there is some kind of disturbance in the country. That's when you see peaks of injuries as a result of torture. But the more common injuries, the ordinary day-to-day accidents and fists and fights, those are the ones that present to hospital on a regular basis.
At the moment, maternal mortality is sitting at around 700 against a Millennium Development Goal of less than 200. And studies which were done recently and released in the month of November 2009 with UNICEF cooperating with the Central Statistics Office show that less than half of the women who delivered in the last 2 years delivered at in an assisted delivery. Most of those women delivered at home, and it's a sign maybe that there's been a time when the confidence in the formal health system kind of dropped in the community. The community was not coming to the health system as the first level of care for them. And now, as the system is rebuilding, I think people need to know that yes, primary health care clinics are still an option and people need to go there.